many tributes, and this is the first tribute that I have had the honour of giving. And one of the things that I think is so interesting for all of us is we often didn't know personally. We may know the name of the person who we're giving the tribute for, but we certainly get to know them afterwards, and we're very honoured for this time that we can spend getting to know the former members of the House, and I think it makes us all better for it. Robert T.S. Frankford was born in Nottingham, England, the son of Margaret, an English Quaker mother, and Walter, a Viennese Jewish father. And as the only member of the Jewish community on this side of the House, I have to wonder why it's just a coincidence. I wasn't aware of that, and it sort of sparked my interest in digging a little deeper. He did his medical training at the University of London in England and at St. George's Hospital Medical School. He immigrated to Canada in the late 1960s, settling in Toronto, and was very proud of his heritage and just as proud of his legacy. And his three very accomplished daughters, Raquel Frankford, I think it's Raquel, not Rachel, and Elizabeth McKay, and the late Emma Frankford, who died too young to realize her full potential. He's also survived by 5 grandchildren, Malcolm, Lila, Sebastian, Olivia, and Theo, and he's very proud of their great accomplishment and wishes them much happiness, I'm sure, and he will never be forgotten by his wife, Helen Breslau, who's with us today. He was a New Democrat member and served in a majority New Democrat government. And he was responsible for inaugurating the first health service organization in Toronto. And he served as parliamentary assistant from 1990 to 91 and used his medical training to advocate on behalf of healthcare issues, travel insurance, and specifically, as we just heard, the Sickle Cell Association. For Dr. Bob, as we know he was affectionately called, practicing as a physician brought with it other responsibilities to his profession and to the reform of primary health care system in Ontario. He was known for his advocacy of universal primary care registration, capitation payments for physicians, and working as a primary care doctor in a team together with other healthcare professionals. When he started his health service organization in the 80s, very few physicians in Ontario were paid by capitation or worked in teams, and as we heard, that has changed since then. Although the current arrangements were not yet to his satisfaction, it should be noted that many family doctors are now working in those teams, and I think that the patients are the better for it. Dr. Bob worked for his country, his province, his city, his community, his neighbourhood, and his profession by volunteering his time to be a member of committees, councils, boards, and other non-governmental organizations with missions focused on the good works in which he believed. When he left the Ontario Legislature, he worked for 3 years as attending physician at Seton House, and during and after that time worked on behalf of the homeless in Toronto. He had a special long-term interest in the plight of foreign-trained professionals, doctors, and others, and he mentored foreign-trained doctors seeking to practice their professions in Ontario. Since his days as an MPP, when he first encountered the Sickle Cell Association of Ontario, he remained involved with them and attended a telephone conference meeting a little more than 48 hours before his death. And I have reflections from the Sickle Cell Association of Ontario through Mary Boyd, who I spoke with last week. Many years ago, Dr. Robert Frankford, affectionately known as Dr. Bob, became involved in the Sickle Cell Association of Ontario, SCAO. It was while being at SCAO that Dr. Bob learned about sickle cell and saw how sickle cell patients were not being treated fairly. That was when he felt the need to advocate for the sickle cell population in the hope of changing people's attitudes. Dr. Bob was a board member and public policy committee chairperson and held that position until his passing. With Dr. Bob's commitment to SCAO, we were able to achieve newborn screening in 2005. He was enlightening fellow physicians here in Toronto to increase their knowledge and approach the College of Physicians and Service to have sickle cell disease included in their curriculum. He also mentored international student doctors on the importance of sickle cell and beta thalassemia disease. In Dr. Bob's efforts for sickle cell, he was often accompanied in his advocacy work at Queen's Park to highlight the sickle cell plight, and I know they've had receptions here. I'm just going to end by reading one of Dr. Bob's many online letters to the editor, and that's what's so fantastic about the computer and the Internet. In September 21st, 2014, in the Toronto Star, Dr. Bob wrote, World Health Organization stats on Ebola contain reassurance that the disease is not universally fatal and there are hundreds of survivors. Sierra Leone has 1,361 cases and 509 deaths. This is an opportunity to research whether survivors share some common factor. It is known that carrying the sickle cell gene produces lower rates of malaria and related deaths. The sickle cell gene is carried by about 40% of West Africans. It would not be difficult to see if there's an increased incidence of so-called heterozygotes among survivors. Dr. Bob, Frankford, Toronto. And I just want to mention that sickle cell, it is interesting. If you're a carrier, you don't necessarily obviously have the disease, but it makes you somehow resistant to malaria, and that was something I learned when I was back in university in optometry school. So I want to thank the family for joining us today. I want to thank the family and friends for sharing Dr. Bob with all of us, and I want to just mention to the family that Dr. Bob and all of us doing the tributes here, it reminds us of why we're all here. Thank you very much.